A year ago, March 12, 2020, the pandemic began in earnest for Johns Hopkins Medicine. I think first about those we've lost, including our patients, our own employees, relatives, friends, and community members. Many thousands of others continue to deal with the damaging aftermath of this virus. We're going to honor these people with conversation, with poetry, and with music. We're going to hear stories from some of you about your experience during this difficult year. This hasn't been an easy time, but through the crisis, each of you has shown incredible dedication, sacrifice, and resilience. This spirit has propelled us forward. You know, when we go on the units and we listen to staff and those who are taking care of these COVID patients, you know, it is really such an important time.
It's been a struggle. It really pulled the rug out from under me. In the beginning, our infection control practices was changing so rapidly.
The challenges, especially at the beginning, were so tremendously difficult. As residents, we're still in training, and there was even fear of contracting the disease itself.
To convert to a COVID unit, whereby we lost a lot of patients, it's very difficult. Very difficult. Sorry.
Watching patients deliver without their families, it's been really hard.
I went from the housekeeping, pretty much being on the front lines, dealing with the patients and stuff like that. Now I'm kind of in the background, just trying to be positive, bring some comfort.
I do have health issues.
So that was hard for you?
It was hard for me.
You were worried about your own health and safety.
I was, but I was also worried about the patients.
I don't know, just seeing just the very sick people. It's like you see or hear like a story in the news, but it's like we live it every single day. So it's like I see it every day, you know, like it's just not a game.
My name is Liz Fox, and last year I developed symptoms of COVID, became very weak. Well, I figured I wouldn't get enough care, the proper care in New York, because the hospitals were already filled. And I came into Johns Hopkins emergency room, and I was seen by the nurse, the triage nurse. My vitals were taken, and I was asked where I was from, and I mentioned New York, and the nurse immediately got up and said, follow her, and I followed her, and it was into an isolation room all by myself. About 2 days later was when they told me I had COVID. I was terrified, and I never felt frightened like that before. Dr. Neeson told me, he said, to look him in the eyes. He said, don't be afraid. And he got closer and closer to me. And all of a sudden I was concerned about him being close to me. After receiving very good care, which I'm grateful for, I was able to return home. It was difficult, very difficult. I couldn't walk in the beginning. I felt so weak, but I wanted to do it by myself. I wanted to say to myself, I'm strong enough to walk alone. I'm very, very much grateful to Johns Hopkins, to all the doctors and the nurses. I had very good nurses. And I'm here, I'm still alive, and I think as a society we are resilient. We are resilient people, especially in this country. We're strong, and we're there for one another.
March. Just as spring nudges against us once again, and the sunlight rests on broken winter trees, not brittle, but ready. And we begin to yield to the hope of brighter days, ignoring just for a moment the sirens in the distance and the discarded masks shuffling along empty streets. And even, once inside, the stark hospital halls and the stubborn beeps. We know it's okay to take a moment, to be silent, to remember. It's okay to know that we are resilient, even as we stand stunned over the heartbreaking loss and the breathtaking recovery. The sliding away of an entire year, the sliding into another year, alone and together, through windows and across halls, bodies hooded and gowned, faces covered and turned. This is love in a pandemic. The eyes that had to smile for us because masks muted our mouths, the screens that said, goodbye, I love you, I'll see you again, the gloves that held our hands, not hands, but still heavy with hope and comfort. March said, I'm ripping away the life you knew, entering like a lion and roaring through the rest of the year. Somehow we held fast against furious winds, losing and gaining friends, patients, neighbors, colleagues, long months of data and doubt, stats and stubbornness, work and worry, yes, and grief and relief and guilt and pride climbing through us like vines or veins. And now, today, we remember we were there. We marched, we gave, we prayed, we loved through a year that lasted so long it's still here. We're still here, now commemorating an anniversary we want to forget. This March, we know it's love that moves us. The naked oaks will start to re-leaf, the yellow crocuses to push through, and having rested for a moment, having reflected on the surreal, we'll stand and stretch with eyes open and hearts unmasked. We'll keep moving forward together to heal.
My name is Jennifer Ford. I have been at Bayview since August 8th of 1994. I'm a third-generation Hopkins employee. My grandmother worked for the president of Hopkins years and years ago, followed by my mom, who was in credentialing and neurology for a long time. It's hard to not just focus on all the bad stuff that's happened, but we have had some amazing success stories. You know, patients that I thought there's no way. We've had several patients who they defied everything and survived. There's a picture of me standing at a door in front of a room in the MICU, and I have my PAPR hood on and my scrubs, and I have my arms in the air, like, yes, I can't even believe that this man is off the ventilator. Couldn't believe that he made it. When it comes down to it, at the end of the day, I still love it there. I don't want to work anywhere else. I don't want to work in any other unit, in any other hospital. That MICU is home to me. And those people are my family, period.
You know, I've been in healthcare for more than 35 years, and I can tell you that the pandemic has tested all of us in ways that we never could have even imagined. While the Johns Hopkins Medicine team is helping our world navigate the largest public health crisis of our time, our team members are also eyewitnesses on the front line, experiencing the pandemic and the many personal and professional challenges it brings. But it has also brought to us together to manage the pandemic as one Johns Hopkins Medicine, working together as never before. Despite the toll the pandemic has taken on everyone, no matter what, the Johns Hopkins Medicine team kept on going, and you're still going. Because we know that the impact of the pandemic will continue to resonate for many years to come. And we have to work together to put plans in place to care for the ongoing needs of COVID patients as we move forward beyond the pandemic together. So I ask that you continue to take good care of yourselves and each other, and take advantage of the resources that are available from the Office of Wellbeing, Spiritual Care, Healthy at Hopkins, the EASE program, the RISE team, and the Department of Psychiatry. I honor your bravery and your commitment to excellence.
Let us pray. Creator God, universal source of all life, as we come to commemorate 1 year since our nation entered into one of its most darkest times with the COVID-19 pandemic, we pause and reflect. We remember the many lives lost, the fear, and yes, the unbearable grief. In the deepening pain, we give thanks to remember hope, that even in our darkest hours, a ray of light still shines through, reminding us of the human bond we have to connect. We are glad for courage instead of fear and care instead of apathy. God, we look within and we give thanks for the resilience that has pushed and pulled us through. We look within and give thanks that even in the midst of many unknowns, that Johns Hopkins Medicine and staff, all of our hospitals and affiliates demonstrated compassion and care, symbolizing the universal gift of love. Thank you, Hopkins family, whatever your role, for your unwavering commitment and valuable contributions to engage this pandemic. We are ever thankful as we remember those lost, that we too remember those who are survivors. Be with those who survived, still on the journey, that each day will bring them blessings with strength. May our spirits be calm and renewed as we move forward in healing and restoration for our patients, their families, and ourselves. In the words of poet John O'Donohue, may the work that we do never lose its soul. Spirit God, you who are called by many names, for this moment and time, we give thanks as we remember the work that we do, that with this work, we rise up. We rise up to move forward in courage, wisdom, and hope. Amen.
It's impacted us tremendously, but we're overcoming it every single day. Even though community physician scheduling has gone mostly virtual, we're still able to be bonded and a unit, and it's made us stronger, I think, than ever before.
I think one of the things that's amazed me most about the COVID-19 pandemic is how much we learned about ourselves, about how quickly we can change, how quickly we can change policies in a matter of hours. We can open new ICUs in a matter of days. I don't think we'll ever be the same as an institution.
What definitely kept me going is my coworkers. Just being able to take the time to go to, we have a resiliency center, so we can just kind of go there and cool off a little bit. So those little things matter.
Take one step at a time. Everybody pensions, I just gotta pray on it and keep it going.
I really believe we're going to make it as an organization, and I think we're going to make it as a country if we all do our part.
Over the past year, Johns Hopkins has treated thousands of severely ill COVID patients. But this is only part of what we've accomplished. We continue to educate our students, to carry on with our research on COVID and in other areas. We've performed almost 500,000 COVID tests so far, and have distributed more than 100,000 vaccine doses to our staff and to people in the community, and have worked hard to help those in our communities who are in need. Recently, the data on COVID has been trending in the right direction. For the first time in many months, there's a glimmer of optimism about where things might be headed. That's good news. At the same time, we know that this ordeal is far from over. But whatever happens, I know that because of you, because of all you have done and continue to do every day, our institution will emerge stronger than ever.
There is light at the end of the tunnel. There is hope. And I thank you for your continued commitment to teamwork, transforming healthcare, advancing medical education, pushing the boundaries of discovery for humanity together. Thank you.
Thank you.